Hi everybody, today we are going to learn about asthma. What is asthma? In asthma, the airway, that is bronchi and bronchioles, are narrowed and swollen. If you look at the picture, this is a picture of normal airway. And during asthma attack, the airways are swollen. You can see it's swollen. And the lumen is narrowed, the space is narrowed. Along with it, there is excess mucus production. If you look at the anatomy, air moves into upper, enters the lower, and trachea divides into two bronchi, and each bronchus enters the lung. This bronchus divide further into secondary, tertiary bronchi, and finally into bronchioles, which end up in air sac called alveoli, where the gas exchange take place. The alveoli is surrounded by capillary network, and it helps in removing carbon dioxide from the blood and oxygenate and provide oxygen to the blood, and the carbon dioxide is exhaled back through the respiratory system. So what happens in asthma? Now let's look into pathophysiology. If you look at the picture of airways, airway is surrounded by both bronchi and bronchioles are surrounded by smooth muscles. This smooth muscles helps to dilate and constrict the airways. During asthma attack, the smooth muscles are tightened that cause narrowing of the airways. So the airways are narrowed. Along with it, the cells inside, the mucus cells inside the airways the goblet cells produce excess mucus. So the narrowed airway and excess mucus in asthma that leads to decreased airflow through this airway. As a result, air gets trapped and there is impaired gas exchange. Proper gas exchange won't take place. As a result, oxygen in the blood decreases, called hypoxemia. Carbon dioxide in the blood increases, called hypercapnia. And when carbon dioxide in the arterial blood increases, pH drops, leading to respiratory acidosis. Now let's see what causes asthma. Asthma is usually triggered or caused by harmful irritant or certain allergens. Examples of airborne allergens include pollen, dust, mold, spores, etc. Sometimes other respiratory infections can trigger asthma. Physical exercise or exercise-induced asthma. The symptoms start few minutes after you exercise and it lasts 10 to 15 minutes after stopping. Sometimes asthma can be triggered by cold air or cold environment, air pollutants or irritants. Certain medicines, example aspirin, beta blockers, can trigger asthma attack. Emotional stress, preservatives and sulfite in the food can trigger asthma, and certain medical condition called GERD can trigger asthma. Now let's see who are at risk for asthma. If there is a family history of asthma, that is a blood relative with a history of asthma, example parent or sibling with asthma, increases the risk factor for asthma. Health history, if a person has a history of allergic dermatitis, allergic disease, that increases the risk of asthma attack. As age increases, it increases the risk. Obesity increases the risk. Smoking or exposure to secondhand smoke also increases the risk of asthma attack. Also, the exposure to any harmful irritants, fumes, allergens can increase the risk of asthma. What are the signs and symptoms of asthma? In the pathophysiology you learned there is narrowed airway and excess mucus production. As a result, patient may experience cough, which may be worsened at night, that can lead to impaired sleeping. Because of the narrowed airway, patient can have difficulty in breathing or increased respiratory rate. Patient may experience chest tightness, shortness of breath or dyspnea, wheezing on auscultation. This is the whistling sound as the air moves through the narrowed airway. It is heard usually during exhalation. As the symptoms worsen, you may be able to hear both inspiratory and during expiration. Now let's see what are some of the tests done to diagnose or in asthma patients. One is spirometry. In this picture, you can see a clip is placed on the patient nose, and patient is instructed to take a deep breath and blow through this mouthpiece, which is connected to a machine called spirometer, which measures the volume of air exhaled and how fast the air is exhaled. Another test is peak flow meter. This measures the force of exhaled air in liters per minute. Along with these tests, allergy test is done to identify the triggering factors. Now let's see the treatment of asthma. The primary treatment involves identify or recognize the triggering factor that causing asthma attack and avoid exposure to these triggers. The pharmacology, the medicines used for asthma are classified into bronchodilators and anti-inflammatory drug. Some of the examples of bronchodilators are beta-2 agonists. The bronchodilators are classified into 3 beta-2 agonists, anticholinergic and methylxanthine. Now let's look more into bronchodilators. What does bronchodilators do? It relaxes the smooth muscles. Remember, in the anatomy we learned the airways are surrounded by the smooth muscles. When the smooth muscles relax, it dilates the airways. There are 3 types of bronchodilators: beta-2, methylxanthine, and anticholinergic. The beta-2 acts by acting on the beta-2 receptors of the smooth muscles and dilate the airways. Anticholinergic, it blocks the effect of acetylcholine. It is a neurotransmitter. It constricts the airways. When it blocked, it relaxes the airways. Third is methylxanthine. It inhibits the action of phosphodiesterase that constrict the airways. When the action is inhibited, it dilates the airways. Now let's see the examples for bronchodilators. The bronchodilators are also classified into short-acting and long-acting. What is short-acting bronchodilators? It acts quickly and gives immediate relief. So it is used in case of acute exacerbation. Whereas in long-acting bronchodilators, it helps to control the disease. There is combination bronchodilators. That means use of more than one bronchodilator or use of bronchodilator and steroid. Now let's look into the example. The example of beta-2 agonist short-acting include albuterol, terbutaline, and the long-acting bronchodilators beta-2 include salmeterol. Some of the side effects of beta-2 agonist is increased heart rate, palpitation, anxiety, etc. Anticholinergic. Short-acting anticholinergic example is ipratropium or Atrovent. The long-acting anticholinergic bronchodilators is tiotropium or Spiriva. The side effects include dry mouth. Now the third is methylxanthine. It is given through orally. Example theophylline. It is not as common as use because of the risk of toxicity. When a patient is on oral theophylline, it is important to maintain the level, the therapeutic level between 10 to 20. Also, if the patient is on digoxin or lithium, remember it increases the risk of digoxin toxicity and decreases the effect of lithium. Now the other classification of medicine include anti-inflammatory drug. Example corticosteroid, which are given through inhalation. And some of the example of inhaled corticosteroid include fluticasone, budesonide, and beclomethasone. When a patient is on inhaled corticosteroid, teach the patient to monitor for thrush. What is thrush? It is fungal infection of the mouth, and it is seen as a white lesion on the tongue or on the inner cheeks. So instruct the patient after using corticosteroid, rinse the mouth or use spacer with inhaler. The other medicines include leukotriene antagonist. Example singular. It blocks the effect of leukotriene and relaxes the airways. Remember, it is not for acute attack. It helps to control the disease. Some of the other medicine used in asthma involved immunomodulator. It is given through sub-Q. It decreases the allergic response and prevent asthma attack. The fourth is non-steroid anti-allergy medicine, example cromolyn. It stops the mast cell from secreting histamine and decreases the asthma attack. Now, what if the triggering factor is exercise induced? You have to instruct the patient to warm up before exercise, use short-acting bronchodilator before exercise, beta-2 agonist or bronchodilators before exercise, and avoid exercise when sick with respiratory illness. So today we learned about asthma. Thank you for watching my video.